Good afternoon, everybody. I'm here this afternoon to talk to you about patient resources and what's available to us as patients. And by doing this, I hope that those of you who are new to diagnosis and this conference have some reassurance that there is a way to understand your diagnosis better. Just to give you some background, I was diagnosed in November 2013 with a stage 1B melanoma. And as many of us have experienced, found it difficult to find clear information on what I should be looking at, what I should be reading, basically. I also struggled with dealing with a diagnosis on my own and not knowing other patients or being able to share experiences. So long story short, as many of you will know, there are a few of you in the room, I started a support group for melanoma patients and their families in Milton Keynes, and we now cover the Milton Keynes, Beds and Bucks area. About 6 months after my diagnosis, and we've been going for nearly 5 years. The focus of some of the work that I've been doing over the past few months is to come up with a patient resource document that will help newly diagnosed patients. It will signpost them towards the places where they need to look for information in those first few months when it really, really is a really terrible time for them. Some information on face-to-face resources. The first person we generally see after diagnosis is our Macmillan nurse, although I do know this does differ across the country. But we should all be offered the support from them and be given contact details and informed of any open drop-in sessions for patients that are run at the hospital. Your CNS works directly with the teams of dermatologists, surgeons, and oncologists who treat you and are often the intermediary in translating medical jargon that we don't understand, or explaining wait times to us, or just generally reassuring us. They also listen when we can't talk to our partners, when we can't have those conversations that you just really want to just cry or just have an emotional moment. We also have our GPs, and again, I know we have different experiences across the country. So some of us have better access than others, but please remember they are there to help you and assist you in understanding your diagnosis. So use their services if you need them. Local support groups do exist, I'm proof of that, but they are, and this is a big but, very few and far between for melanoma patients. The ethos of support groups is for patients to run them. They're not supposed to be run by nurses. We're the ones to push those groups forward. So, if you want to start one in your area, or you're interested in starting one, have a think about that. Funding is available. It's not hard to secure. And if you want to have a conversation about it, do approach me at the end of the session, and I'm happy to help. I'm not a statistician. I did have a look online just to give you some brief figures. We live in a world of social media. Google, email, there is so much information available to us that it's almost too much. Many of us here know the term Dr. Google. He's right there in the corner. On this slide, we can Google too much, which actually leads to anxiety, which Rebecca was just talking about. You know, first thing I did after diagnosis, onto Dr. Google, melanoma. If you look at the slide, 240 million results for a search on melanoma. Thankfully, NHS England, Cancer Research and Macmillan are in the top 3, so there are really good sources of information. 48 million results on melanoma treatment and 13.9 million results on how long will I live, survive, which is a key question I think everybody has when they get a diagnosis. So do use Dr. Google, but please be cautious and use trusted sites. What's available online? You can find a wide range of information online. There's worldwide research, patient blogs, patient advocacy groups in the UK and Europe. There's also excellent information on the different types of melanoma, mucosal, ocular, nodular, lentigo. There's quite a list. We also have trusted Facebook. There are many support groups for patients on Facebook. There are groups that deal with any stage, and there are also more focused groups that deal with stage 1, 2, and 3. You've also got UV companies that offer clothing. You've got the apps, which we talked about earlier. and you can use those to photograph your moles. Moving back to support groups, many of you have found your way to the conference through Facebook or via one of the many online support groups, or through maybe posters put up in your dermatology or in your hospital units. Local support groups who meet face-to-face, as I've said, there are not many around. There's one in Milton Keynes. We're branching out. We're trying to cover the sort of Thames Valley area, so we capture all of the patients there. There's a group in Cambridge, and I've just found out from a couple of the CNS nurses that I've met here today that there is a group in Sunderland as well. There's also Mascot in Scotland who have regular meetings. But as I said, there's not many, and this is because it's patient-led. It needs a patient to kind of take the reins and be willing to organise and corral everybody together. And they are really useful. I have a group of people over there. They are useful, aren't they? Yes, they're nodding. Most of the Facebook groups are closed, so you cannot, if you've got a Facebook page and you're on social media, any comments you make on these groups, they will not show up on your feed. So if you're worried about that, and you do have to request to join because they are closed groups, so just be aware of that. Other support services that are available, we have Macmillan provides services to help you navigate pensions advice, forms and PIPs. There's also hospices who can help you with advice on financial services, things like that. As a cancer patient, we are entitled to free prescriptions. It's a common question that happens when I meet new patients. They're not aware that they're entitled to free prescriptions, so do make sure that you talk to your GP or your oncologist. There are also payments that you may be eligible or dependent on, dependent on what stage of treatment you are on and how it affects you, and these are PIP payments. I would suggest that you go through to the Macmillan site, have a look on there, and then speak to your nurse to get some advice, or your local hospice. Other things that you can find online, because it is vast, there are apps for everything these days. I wouldn't recommend paying for one. There are lots of these skin apps out there that claim to diagnose skin cancer, and you can be paying a fortune for them. I do use an app after the conversation earlier on, and it's just purely to photograph moles, keep an eye on my moles and track them. UV clothing is widely available, but it can be very, very expensive. So I would suggest that you search around places like Sports Direct, Surf Dome. They all offer rash vests, all these types of UV clothing, hats, and everything that you would need when you're in a hot, sunnier climes. Sun cream is a personal choice. I know we haven't touched much on it at the conference, but I think it's down to you to find the one that actually suits you. We've had SunSense here today. There's hundreds of brands. I myself have tried Lacura recently, which is an Audi brand. It's 5-star rated, absolutely brilliant. And I've got really sensitive skin. So you just need to shop around, find what's good for you, make sure it's 30 to 50, nothing less. We also have makeup brands. I'm putting my little minion face up because I'm nearly at the end. For the ladies, it's personal choice, and lots of makeup does have SPF in it, but I would always use another sun cream on top of that. But there's loads of brands out there, so it really is up to you to choose what you want to choose. And there are brands for men as well, so we don't leave you all out. But that's my minion. I have finished. Just to give you some information. Thank you.